Yeah, that's what my friend said. He has two little grandchildren, two boys.
Baseball's the start.
Is it?
Yeah.
Soccer on Saturday morning.
Yeah, plus my daughter plays school volleyball, so we've got a game tonight at 5 o'clock.
It's 3:30. I'd like to call the Mesquite County Board of Commissioners meeting together. If we would rise for an invocation, please. Let us pray. Lord, as we approach spring, let us keep the spirit of new beginnings in all that we do as a commission. The decisions that are made here, we need to keep in mind how they affect the lives of all of our citizens, and help us to keep that burden as we deliver it today. And as always, protect those who watch over us both here and abroad. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Commissioner Skolnick couldn't make it today? Yeah.
I'd like to see his grandkids yet.
It could be, you couldn't fly in this.
Yeah.
Okay, roll call, Madam Clerk.
Commissioner Cross.
Here.
Commissioner Derazinski.
Here.
Commissioner Engel.
Here.
Commissioner Hughes. Here. Chairman Mahoney.
Here.
Commissioner Nash.
Excuse.
Commissioner Sable.
Here.
Commissioner Skolnick.
Please excuse.
Vice Chairman Wilkins. Here. 7 present, 2 excused.
Okay, we do have a quorum. Next on our agenda is the approval agenda. I would like to add about 3 or 4 things under my report. There is an appointment, 1 to community corrections, 1 will be to solid waste planning, 1 to workforce development, and then to set up a committee to interview folks at community mental health. Will apply.
I think the motion the agenda be approval of those again.
Support. Moved and supported to approve the agenda with the amendments. Any discussion? All those in favor signify by saying yes.
Yes.
Those opposed, no. Motion carries. We have an agenda. Next is the approval of minutes of February 26th that have been presented.
So moved.
Support.
Moved by Commissioner Cross, supported by Commissioner Hughes to approve the minutes of February 26th. Any discussion? Concerns?
There's a change on those minutes reflected from community mental health. There was a date that
For the
needed to be
dates
changed.
that needed to be changed.
Oh, yes.
Okay. Net. All those in favor signify by saying yes.
Yes.
Opposed, no. Motion carries. Now we're at the point of the meeting for public comment on an agenda item.
Me?
Okay. Assuming you wish to speak to the jail, which...
I wish to speak to the jail. My name is Andrew Fink. I live at 415 South Division Street in Whitehall. It is irresponsible for you to approve the purchase of a jail or the purchase order for a jail or whatever you call it, as long as you have your prevailing wage rules in effect. By all estimates, prevailing wage rules add at least 10% to the cost of a contract. And so you're talking about a $41 million contract. Yes, like taking $4 million of the taxpayers' money and just giving it to a privileged few for no good reason at all. One thing to take our tax money for the general welfare, like parks. Another to take our money to help the poor people. It is insane to take our money to help middle-class workers just because, well, what they actually feel like doing it. And now when you remember, you don't have a local preference rule here. You don't even know if those middle-class workers you're going to help come from Muskegon County. You might be helping people from Battle Creek or Grand Rapids. You pay the market rate for gasoline, for paper for your offices, but for some reason you don't want to pay market wages for the labor. And remember, prevailing wage is not market wages. Prevailing wage is union wages under the rules of the state of Michigan that your policies require the bidders follow. Prevailing wage came into effect as a rule to keep black Americans from competing with white Americans on public jobs. That was its history. That was the basis of starting it back 70 years ago or 80 years ago with the federal government. It's no longer the reason people have prevailing wage now. I don't suggest that it is, but the effect is the same. It requires that every worker be of a higher skill because they have to be paid a higher wage, which means it keeps the people at the bottom of our economic levels from public jobs. So the effect is, again, to keep blacks from working on public jobs. It would be ironic for us to exclude blacks from the labor, which is what a prevailing wage thing will do. At least not exclude them, but reduce their participation. To build a jail in which we will house black Americans. I want you to think of the taxpayers, the farmers in Montague, the shopkeepers in Muskegon and all the other towns in the county, the store clerks, the people struggling to keep their homes. You are going to tax them more so you can give money unnecessarily to workers that we don't even know who they are. Think of what you could do with the $4 million. This county is well in debt for the retirement benefits. You could take $4 million and use it for that. Or think of what your taxpayers could do with that $4 million if you just let them keep the money instead of throwing it at laborers from who knows where. Thank you for your attention.
Thank you, Mr. Fink. Anyone else wishing to speak? Approach the podium, please. And give us your name.
Sure. Are there cheaper agendas? I just can't see the rest of the agenda. Okay, thanks. Jail approval.
Yeah, it's under the court book.
Okay. Nell Schaefer. I'm here to also speak about the jail. I guess I'm here to urge the county and urge the commissioners to not approve an expanded jail. It's not something new coming from me, but yeah, I see it as just disappointing for the county to move in a continual direction of increased incarceration. I'd also like to say that, or bring attention to the fact that it seems to me that the taxpayers will be, having to bear some of this cost, but also it seems to me that 6 to 15 families in this county, who, if you're cutting 6 to 15 employees at the jail, in order to save money to be able to repay the bonds, it seems to me that burden is on those 6 to 15 families. And that doesn't seem to make sense to me. So we're gonna put extra burden on a few families because they're gonna lose their jobs. We already have a high unemployment rate here in Muskegon County. And I think it's also been shown in a number of studies that the higher the unemployment rate, the higher the incarceration rate. I unfortunately don't have the numbers for the county in front of me. But in the numbers released by the Sheriff's Department for 2011, I think it was about 40 to 50% of the people incarcerated were unemployed at the time of incarceration. So I don't think that makes sense. I also don't think it makes sense to put $41 million into an expanded jail and to have more, to continue the same pattern that this county and other places in the U.S. have also followed, which is just increased incarceration. And so I would urge the commissioners to think twice about that, and to I think that money could be better used for actual and real diversion programs, and not to continue to expand the jail. And I fear in the future that another expansion will happen as well, and we're not going to be getting anywhere. We're not going to have lower crime rates, and we're not going to have better ways of dealing with conflict. I think that's all I have to say today. I urge you to vote against approving the jail.
Okay, thank you. Anyone else?
Good afternoon, Ryan Dunn at 1538 White Pine Court, Twin Lake, Michigan. I rise today and I got here just in time to speak in support of the prevailing wage rule that the county has. It's not really intended, it's intended to protect the wage of the local construction worker. I've been a local construction worker since 2000. I've worked in the plumbing and mechanical industry, so I know the difference in quality that you receive on a plumbing and mechanical project when you use prevailing wage. And that's union and non-union alike. If you hire a union contractor, you're going to get somebody with a certified apprenticeship, registered, safe, licensed. Even if you hire somebody non-union, you're going to get the top quality person that that contractor has because they have a set of prevailing wage workers who are used to earning that higher wage. To say that it was somehow the law was intended to discriminate against African Americans, I think is completely false. What it was intended to do is to keep Southern contractors in states which had a high slavery rate from coming up to northern states and undermining the local wage. It had nothing to do with the people. It was about protecting the wages in the local community. There was a study done recently by a professor at the University of Wisconsin that examined prevailing wage on public funded projects and found that the small benefit to the county that it would save in construction costs was far outweighed by the tax revenue they would lose by undermining the wages of the local construction workers. I would urge anybody, just if you have any questions about this, search it yourself. Don't take my word for it. Look it up. There's several studies, none of which outside of the Mackinac study will tell you that prevailing wage is going to save the taxpayers money. Thank you.
Thank you. Anyone else?
Matt Crean.
Good afternoon. When I was here last week, I talked a little bit.
Would you give us your name, please?
Matt Crean.
Thank you.
When I was here last week, I talked a little bit about this, but since then I've done a little bit more research, and today I was on the phone with a member of the Department of Corrections for over an hour, and what we were discussing was staffing numbers for jails. And he indicated to me that right now, based on his information, you now have a bare bones staff, 46 guards. So when you're going to 544, 379 rated, you don't have enough staff right now. So I find it almost impossible to think that you could decrease the number of guards by 6 to 15 and still expect to run the jail safely. There's a website that you all can take a look at. It's called NICIC.gov. And if you, in the upper right-hand corner, if you punch in staffing, you're going to get a whole bunch of documents on the proper number of people you should have for each inmate. And it indicates one of the first things that popped up was if you don't have enough staff, it's not going to be safe for the inmates, it's not going to be safe for the guards, and it's going to lead to a bunch of lawsuits. I took a look at some of the other jails to see what they had for the number of inmates and the number of staff. For one, the first thing that jumped out at me was Ingham County. They have 601 inmates. Now, Ingham County is a lot bigger than Muskegon County. 544 inmates for Muskegon County versus 601 for Ingham. That seems like we're a little bit high. I don't think we need that much space, but I've said that from day one anyway. Kent County had an average daily population in 2012 of 1,157 inmates, and they have 191 staff. This would be the guards, only the guards I'm speaking of. I'm not speaking of the support staff at all. Kalamazoo has an inmate capacity right now, before their expansion, of 327 inmates, 48 guards, 6 sergeants. Eaton County has 374 with 35 guards, 7 sergeants, 1 lieutenant, and 1 command officer. Allegan has 169 capacity right now, I guess before their expansion, 24 guards, 6 supervisors, and 1 lieutenant. When you take a look at this in detail,
And based on the conversation I had this morning with the gentleman from the Department of Corrections, and he's worked there long enough so he's well familiar with what's going on in Muskegon County, he said there's no possible way you can shrink the number of guards and still expect to go ahead and have a safe jail. And I explained to him the concept of the tunnel underneath Pine Street. He became even more surprised with that, because essentially what you have is two separate jails. Even though technically it's one jail, you're still going to end up with two separate jails as a practical matter, because you're going to have guards at this one on this side of the tunnel, and then you're going to have guards in the new one. The other thing he brought up to me was this: despite the fact that you have this set up in a pod to where allegedly one guard can be at a house in the middle of it, watching all these particular pods, he said you still have to have a guard physically every 60 minutes go to where all the inmates are. So you're still not going to get away with just having that. You've got to have a guard take a look, inspect the inmates, make sure they're not up to something, make sure one of them didn't pass away in a cell or unconscious in a cell or something like that. There's just safety factors that have to be considered here. So before you go forward, I think those things need to be all in place. The idea of we need to figure out how to pay for this, let's get rid of the guards so we can float the bond issue to go and then pay for the bonds later. Getting rid of the guards isn't going to be the answer. So as we stand here today, we don't have a sound way to go ahead and fund this. And if we don't have a sound way to go ahead and fund this, whether somebody's for the jail or against the jail, you still shouldn't go forward with this plan today. It has to go back to the drawing board for adequate funding, because all you're going to end up with, when this thing gets done, is a mess on your hands. And the county, unfortunately, has gotten itself into enough messes with other things that were unexpected. We certainly don't need to go ahead and get into one where we know what's expected. So, thank you for the opportunity to talk today.
Thank you. Anyone else? None. Move on. Communications. I believe we received any outside of the public comment. Committee reports. Courts and Public Safety Committee.
Thanks, Mr. Chairman. The Courts and Public Safety met on March 5th, 2013. It was recommended, and I move CPS 13/03-06 through CPS 13/03-10.
Support.
Been moved by Commissioner Cross, supported by Commissioner Berezinski, to approve the Courts and Public Safety Committee report of March 5th. Any discussion?
I just have one comment on the jail, and that is the motion here is for us to go out for bids for engineers that would be designing the jail so that we can eventually get a price back for the bid, for the jail. This is not buying the jail yet. So I just wanted the audience to understand that situation right now.
Thank you. Anyone else? Commissioner Skolnick.
Just following up on that, the issue of prevailing wage is yet to come. I mean, we're not there yet, as we've got to get architect and bids, and there's a lot more to come yet.
I guess I have a question on that too. As far as prevailing wage goes, since there seems to be two conflicting opinions on that, when we get to that point, is it possible for us to bid it both ways so we can actually look at that option when it comes before us? We could choose that.
To do that, we would have to waive our policy, however.
When will we have the opportunity to do that? When the construction bids go out. Thank you very much.
Most bids are not given on price alone. They are given as an overall consideration of what can be best for the county. And I think that's important rather than focusing on one small part of it.
Anyone else? I think a large portion of what we're talking about here, labor is only about 30% of the project. The rest is material and so forth. And I do believe, and maybe Heath could explain briefly, that we're not talking $40 million.
The conceptual phase that we've just completed showed a range of the project. And the range is between 35 million and 41 million, the high range being 41 million. The range does not just include the jail. The range also includes a juvenile transition center. It isn't all just for the jail.
Thank you.
And one thing too, once we hire an engineering firm, there's a lot of engineering that can take place and different options that will be available through the engineer, but going out to bids that can dramatically decrease the price of the jail and still keep the functionality of the jail. So we still have a lot of room. We really have no idea what it could cost. These are just estimates at the moment. We won't know that until we actually get it designed out and move forward.
Anyone else?
Mr. Chair, I'll be voting in support of this, but I just wanted to make sure that I commend the Jail and Juvenile Transition Center Committee long before I ever got on there, as well as our county staff, to getting us to this point, to getting us a plan, and also a financial review of where that plan's going to take us.
I will echo those comments. Many hours of staff time, consulting time, committee time have been put into this. We have looked at almost every little corner we could possibly. I believe this is the best plan for the county to move forward in this issue. It's been a long time coming. It needs to be ended in the fruition of a project so that we can move on to other items instead of the jail has been a 40-year issue here. We need to move on. Anyone else besides my sermon? Okay. Roll call, Madam Clerk.
Commissioner Derasinski.
Yes.
Commissioner Engel.
Yes.
Commissioner Hughes.
Yes.
Commissioner Sable.
Yes.
Commissioner Skolnick.
Yes.
Vice Chairman Wilkins.
Yes.
Commissioner Cross.
Yes.
Chairman Mahoney.
Yes.
8 yes.
Okay, motion carries.
Oh, sorry.
Oh, that's all right.
Thanks, Mr. Chairman. That concludes the report.
You're quite all right. You're
Days there.
Too young for a senior moment, Ben. Commissioner Wilkins.
Thank you.
Human Resources Committee.
Thank you, Mr. Chair. The Human Resources Committee met on March 5th, 2013. It was recommended, and I move H.R. 1303-14 through H.R. 1303-20.
Support. Okay, it's been moved by Commissioner Wilkins, supported by Commissioner Derasinski to approve the Human Resources Committee report. Any discussion? Seeing none. All those in favor? No, we better do a roll call. Roll call, Madam Clerk.
Commissioner Engel.
Yes.
Commissioner Hughes.
Yes.
Commissioner Sable.
Yes.
Commissioner Skolnick.
Yes.
Vice Chairman Wilkins.
Yes.
Commissioner Cross.
Yes.
Commissioner Derasinski.
Yes.
Chairman Mahoney.
Yes.
8 yes.
Motion carries. Okay, now we're to my report. There is a motion before you concerning proclaiming the month of April as County Government Month.
Support.
No, it comes with your report. I'm in a hurry to get this process. It's a proclamation. Just kick me once in a while. Okay, with that, we've had, you move the proclamation, somebody want to second that? Ben, to designate April 2013 as County Government Month. Questions? If not, all those in favor signify by saying yes.
Yes.
Motion. And those no, motion carries. The St. Patrick's Day Parade, Saturday, March 16th at 11 a.m. downtown Muskegon. Just a quick question for where are they going to be? 4th Street? Okay. So I guess we will meet on 4th Street. Clay. Okay, board planning session, the audit. Presentation Tuesday, April 9th at 1 o'clock in South Campus, if that's okay with everyone.
I just wonder, why do we meet at the South Campus? Why don't we meet here, since we got a meeting right after that here?
Primarily because it's a little bit more convenient. It's not so, it's a little bit more, we're all on the same level kind of thing.
We're all on the same level.
The public-
I understand, okay. I see what you're saying, okay.
And sometimes this room is used before.
Okay.
Like today it was.
Oh, okay.
2 o'clock.
Okay, I didn't think about the jurors and stuff, okay.
Okay. Now, we've got that, back to my appointments. For the community. Okay, I'll do the 3. Community Corrections Board, I'm going to recommend Mr. John Snyder. For the Solid Waste Planning, Terry Radinger. And the Workforce Development Board, Teresa Schaefer.
I'll make a motion to concur with the chairman's recommendation.
Support.
Moved and supported to concur with the recommendations for those particular committees. Any discussion? Being none, all those in favor signify by saying yes.
Yes.
Those opposed, the same, or no. Motion carries. The next, as I mentioned, we have 2 commissioners who are on the Community Mental Health Board, and I would like them to interview candidates for that particular position. That would be Mr. Terry Sabo. I haven't spoken to Mr. Nash, but he is now recruited. If that's okay, we can move forward with those, and they will bring back a recommendation to me as to who they think would be best there.
If I may, sir.
Yes.
There would be other people besides those 2, right?
They are going to interview them because they're on the CMH
For
board.
the appointments to citizens for that. Okay.
So they will be, since they're there, they have a better recommendation to me for the appointment. With that, I believe I am done. Madam Administrator.
Thank you, Mr. Chair and County Board of Commissioners. I present to you for your consideration today approval of the accounts payable covering February 13th, 2013 through March 1st, 2013.
So moved.
Support.
And seconded to approve the accounts payable covering February 13th through March 1st. Any discussion? Seeing none, all those in favor, by having your roll call. Roll call, Madam Clerk.
Commissioner Hughes.
Yes.
Commissioner Sable.
Yes.
Commissioner Skolnick.
Yes.
Vice Chairman Wilkins.
Yes.
Commissioner Cross.
Yes.
Commissioner Jarzynski.
Yes.
Commissioner Engel.
Yes.
Chairman Mahoney.
Yes.
8 yes.
Motion carries.
My report.
All right, we're now at old business. Anyone having old business to bring before the committee?
Last week, we spent some time discussing how important it was to us to use locals, bidders, and anything we have possible. And I noticed that on the cars that we bought for community mental health, that Benton was not one of the bidders. And I did ask somebody I knew at Benton, and they did not know that the bid was going out. And I just would like to make sure that we have a better way, or we know how, or what they're supposed to do, so that all of the people that we have in our county that could possibly bid on something that we're going to buy have the opportunity to know how to do it. I don't know how we go about that, but there's got to be a way. And I'd like to be able to tell them how to do it, and I don't know that way.
I believe there's a list of vendors that the county keeps. Number 1, that sends out email blasts too if there's something coming up. I'm surprised Benton has not been on
I was
that
too,
list.
and I looked on the purchasing website, and it didn't give me an application form to fill out or anything, and I didn't know where they should go to do that. So I don't know if that would go through purchasing or how I would get them
I'll work with staff on that.
Okay.
And we'll also contact Benton for a contact.
Okay, thank you very much.
Any other old business?
I was gonna ask Ted if I could. We spoke briefly on the veterans issue. Whenever you can, a couple people would like to hear what you have to say about that. Okay? Okay, thank you.
Any other old business? Any new business? Mr. Skolnick, you made it through the fog?
I made it through the fog. I don't know if anybody, like people like to blame our airlines when flights are canceled, having missed the flight because of the fog in Muskegon, which apparently was the only fog in the...
Yeah.
But I learned that United will, or SkyWest won't fly if the visibility is not more, it has to be at least a mile. And it was less, it was about a quarter of a mile, and in fact, I called Marty to try to, our airport manager, to tell him to let the plane land, and he said it was out of his pay range, so we drove home.
Thank you. Any other new business besides picking on you? Nash?
First, I wanted to apologize for my tardiness. Anyway, there was an emergency with one of our youth at this program, but I know that we passed the proposal for the jail, and I also want the commissioners to be looking to consider putting forth a resolution for a House bill that's been put forth by one of our senators in regards to that jail that will actually help us save some tax dollars regarding that jail by not having to pay the regular tax that we don't pay for the products that we use it for that jail. So construction material be tax-free. And that was just put forth. It's just got a bill number. I was trying to look it up, but I can't seem to pull it up right now. But it's got its new bill number, and we want to put forth a resolution, hopefully, to support that to help it pass, and it could help us save a lot of dollars in the future with our construction.
Thank you. Any other new business? I will mention that there is an emergency dredging bill working its way through the Michigan legislature. It's been approved by the Senate. It's in the House, I believe, being introduced today, which will provide some money for municipalities, for municipal docks and marinas to be dredged this coming summer. In addition, there's some movement on the federal level to dredge not only commercial harbors, but to do some recreational harbors along the lake shore as well, and that would include Montague and Whitehall, Pentwater, and those folks who don't fall under the commercial but are recreational harbors. So those things are happening, especially this time with the record low water level. It affects shipping on the Great Lakes, and it also affects the recreational use of those waters. With that, all of my new business. Anybody else have new business? Not, we have.
How about bass fishing?
They're in the phone. Okay. And actually all summer, but that's beside the point. Okay, we are now at public comment on a new topic, and I have a Dawn, and I'm going to mispronounce the last name.
Dash.
Dash, okay.
That was quicker than I thought. My name is Dawn Dash, 7098 Cooley Road in Fruitport. Good afternoon.
Afternoon.
I am a lifelong resident of Muskegon County, except for being born in Grand Haven, which I won't hold, you won't hold against me. My entire professional career has been spent serving and caring for Muskegon County residents. I have been an employee of Hackley Hospital and currently Mercy Health Partners for the last 31 years. And I am very concerned about a decision that's been made by Mercy Health Partners to construct and consolidate their facilities. I do understand that Mercy Health Partners is a private company and will make changes as they see fit, but I would like to discuss the effects of their decision that will be on the community. excuse me. In a recent Muskegon Chronicle article, Greg Loomis, who is the interim CEO of Mercy Health Partners, said the need to consolidate the ER, surgery, and ICU services for Mercy Health Partners by closing the departments at the Hagley campus and moving them to the Mercy campus in 2016 was based on decision being made to make a better healthcare system for our community and our families. Although this may be good for Mercy Health Partners and the residents of Muskegon County that have health care coverage and a primary care physician, it will affect most underserved members of our community drastically: the working poor, minority, elderly, and unemployed. In the same article, Mr. Loomis said the consolidation is a response to health care reform and as a result of the Affordable Health Care Act. Part of the Affordable Health Care Act is to expand Medicaid coverage to adults under the age of 65. The qualifier will now be based on income, up to 133% of federal poverty level the idea is that poor will have Medicaid and can go to a primary care doctor. I called 20 physicians in Muskegon County, from Whitehall to Muskegon. Of those 20 offices that I called, they were all mostly were groups of 2 or more physicians. Very few were single physician practices. 9 of those 20 are not accepting any new patients. Of the 11 groups that are accepting new patients, 7 of these do not accept Medicaid at all. 2 accept limited Medicaid plans. 1 stated new Medicaid patients are on a waiting list, and only one, said they accept Medicaid patients. In a February meeting with Mercy Health Partner employees, Mr. Loomis stated that approximately 115,000 patients were seen in the ER departments at Mercy and Hagley in 2012. That number will undoubtedly be higher by 2016. When the Hagley ER is closed in 2016, he anticipates that the Mercy ER will be able to accommodate 70,000 visits. When questioned regarding the remaining 45,000 unable to be seen in the ER, he replied that the community will need to be re-educated on the use of ER. If I, a college-educated woman, using the resources that I have available to me working in healthcare, have a difficult time finding a primary care physician, I can't imagine what an uneducated person with limited resources is going to find a primary care physician. As the ER will be seeing less patients, the resources available now will be unable to handle the wave of patients that they will be seeing in 2016. In another Muskegon Chronicle article on this subject, Dr. Remington Sprague, who is the medical director at Mercy Health Partners, said that more patients should be visiting their primary care doctors. According to a University of Wisconsin County Health Ranking Report, the national benchmark for patient to doctor ratio is 631 to 1. In Muskegon, we are 1,188 to 1, nearly double the national benchmark. How are people going to be taken care of? That is something that we need to address. Hagley Community Care, Muskegon Family Care are at capacity now. They accept 5 patients at Hagley Community Care a month, and you call on the last business day of the month, and you try to be one of the first 5. Muskegon Community Care takes 35 patients. We're going to have at least 50,000 patients that aren't going to be seen in ER at all. This also is going to affect us economically. By closing the Hagley ER and making it a high-functioning urgent care system, it's been reported that they will only be open a limited number of hours, not 24 hours a day. This means that at least one shift of workers, medical professionals, environmental services, is going to be laid off. By closing the ICU, you're going to have 3 shifts, 7 days a week, medical professionals, janitorial services, food service, radiology, that is going to be unemployed. Unemployed people may make over the 133% threshold. They may not qualify for Medicaid. They're not going to have the money to pay for private group insurance. we're going to have a lot of people that are going to have no health care options at all. As a community, as this board, we need to address this issue, how we're going to take care of our people before 2016 comes in. Thank you very much.
Thank you for the information and your concerns. I think we share them as well. Any other public comment on a new topic? If not, I'd see Ms. Ackerman in the audience as usual, keeping track of us, I hope. Pete, that's all. Anyone else? And I need a motion to adjourn. And we are adjourned.
My neighbor sure likes